Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We got Hector in here with us this afternoon, and Hector and his family drove up here 6 hours, right?
That's right.
From down in South Texas, on the border actually, of Texas. And he is a dentist down there, been practicing 23 years, I think you said?
23 years.
Yeah, so he has been over patients and doing a lot of stuff ahead of him all the time. And he's been coming in, he came in today complaining of left sacroiliac pain down in his pelvis that goes out into his left lateral thigh, which is pretty common. He sometimes gets some paresthesia, which is numbness and tingling down in the front part of his leg and his big toe. Thoracic spine tightness is especially prevalent with his head being so far forward working all the time. And he gets neck pain and stiffness as well. Now, something that we see a lot of, and Hector specifically mentioned this, he feels very compressed in his spine and has done for years now, right?
That's right.
And he's a runner. I mean, he tells me he runs, 5-6 miles a day, every day. That's not something that we ever recommend, but, if he wants to run, that's his body, his health. I told him, you miss a line, knock him out, we'll line him up, so. And he also gets some anxiety feeling, some kind of that fight or flight response too. That's specific for the sympathetic nervous system from T1 down to T12 in the thoracic spine. That's where the sympathetics emanate from the spinal cord itself and the brain. So that's part of the autonomic nervous system. And when you get that fight or flight, you kind of just get anxiety and fast heartbeat and flutters, right?
That's right.
Yeah. So this is Hector's very first adjustment here at our office. We've already done his history and examination. Was that thorough too, from one professional to another?
It was definitely the most thorough exam I've had.
Okay, good.
Yeah.
So this will be his first adjustment. So we're going to put him back on the BioPhysics table here first so I can get a feel for his spinal range of motion and tissue stretch and tissue tonicity. Clinical findings. His left leg's short in the prone position by 1/2 inch. However, when I bring his legs up, they get exactly even, and that tightens up in his lumbar spine. That is a positive gear field on the left, and then positive knockless because it tightened up in the lumbosacral spine region. He's got left SI palpation tenderness, L4 and 5 tenderness, and that paraspinal muscle hypertonicity all the way up into his lower thoracic spine. He's got multiple thoracic spine rib cage subluxations, and his shoulders are tight all the time from just his work, 23 years of bending over, fixing people's teeth. That's tender right there on the right, and right there on the right. He's got about 3 subluxations up in his cervical spine here. So I'll start off adjusting his left SI joint, since that's the primary subluxation complex in its pelvis. Then we'll move over to the right SI. And then the sacrum, center, and then left. Now some of these might be a little sore at first, Hector, like this one. Yep. L5 straight PDA, L4 straight PDA, L3 PDA with the little I-to-S drive, L2 PDA with the I-to-S drive. Perfect. There it is. A little deeper in person, huh, Hector?
Yeah.
Legs are exactly even after that adjustment. You see the difference? Mm-hmm. This should feel a little easier in your back this time, Hector. You tell me.
Definitely.
Cool. So we got rid of Deerfield. We also got rid of Knockless. That's pre and post orthopedic test, showing objective improvement. And that's why we check posture before and after every time too, because that's also objective. Let's go on your back for me, please, sir. Posture is a mirror of spinal biomechanics. Lucy's gonna be looking in the mirror of her posture now. She might be coming up with you next time, Hector.
Yep.
Slide down this way just a little bit. There we go. Now put both arms out like this, straight out sideways. Yes, sir. I'm gonna adjust your AC joint, slide down about another inch. This way. There you go. AC joints. Left clavicle, right clavicle, costosternal joints. Yep, you can relax your hands right there on your stomach for a moment for me, Hector. Let this right leg go like a limp rag. Yes, sir. You should have felt that from your knee all the way up to your lower back, Hector.
Oh, yeah.
Did you?
Yeah.
Good. Let me have this one too. There we go. Good job. All right, I'm gonna help you up here, and we're gonna face over towards Lucy and Alex. Alex, you should grow up and be a chiropractor, and you can adjust mom and dad. Okay, let's keep that chin up. You're so used to having your head down, that's kind of a habit. Yeah, hear that crepitus in there? I'm sure you felt it too. There we go. Yep. Mm-hmm. I'm not going to mess your elbows, your arms, your hands up, because I know you need those to earn a living. All right, let's come on around this table. I wouldn't do it even if you didn't. So I'm going to have you lay on this table on your back, Hector, with your butt right there. Head up this way, please. You got front row seat, Lucy. Just let your legs relax. The table's going to lift them up. Now, if you sleep in this position, your spine will heal quicker and stay that way longer.
Okay.
So you should feel pretty relaxed in this position right here in your back and your neck.
Yes.
See, he's got a forward lordosis in his neck here because his head's all the way back versus being on a pillow. Look what happens there. Reverses that. Relaxes the paraspinal musculature in the lumbar spine. So I'm going to pin your pelvis in on both sides here with these big pins, Hector. Now, Hector's watched our YouTube videos, so he knows he's fixing to get the ring dinger. Slide down a little bit. And there you go. This is going to feel tight, Hector, and it should. Yes, sir. You're not going to get away now. All right. So this adjustment, Hector, I'm going to decompress your spine from your skull all the way down to your sacrum. You're going to just keep your teeth together. Don't bite your tongue. Breathe through your nose for me. Just like that.
Yeah.
Yes, sir. Should have felt that go all the way down. Did you?
Yes.
Good. Now, you might be here for the weekend. Get these pins in out there. It is. Wow.
Get your workout in.
Look how much I deformed that pin. Just pulled him.
Wow.
Pretty good amount of pressure.
Ooh.
Okay. You okay?
Yeah.
There you go. Just like that. And that. I'm not shy about adjusting.
Oh.
I bet that was a lot different than the last experience you told me about.
Yeah.
Cool. Let me help you up sideways. Bring your legs over. You always want to try to get up sideways. Let's stand here in front of the mirror again, Hector, and see what you're looking like now. Come back this way about 3 steps. Look at his head's back further. See, it's not so far forward. His hump's going down already. You might be making this trip every once in a while from the back or from the South Texas. Come way back this way. Keep those shoulders back for me though, Hector. There you go. You'll feel a little tap here and there. Now relax. Go ahead and do your forward and backwards again. This should feel easier to you this time, but you tell me.
Yeah, like if I have
Smoother?
a lubrication, like
Yeah, put a
oil.
little WD-40 in
Yeah.
there. Take a look in the mirror too. Look how we opened this up. So it was over to the left, if you recall.
Wow.
So, this is your very first adjustment from us. You've been adjusted by other chiropractors, you told me.
Yes.
How would you describe to the rest of our crack addicts worldwide about the difference between what you received here today versus what you've had previously from other providers?
Well, the main difference is, you know, it just felt a lot more thorough. Basically, from the foundation up, it's like you know, trying to dig deep into what possible problems can become,
Right.
and what they lead to after, you know, a long-term usage of our bodies.
Right.
So it's very detailed.
Yeah,
Very
we want to do it that
detailed
way because
and-
we don't want to rule out any
But
contraindications you might have.
the only thing was that, yeah, I mean, it's like even before I told you, you kind of knew exactly where
Yeah,
where the
Where you're
problems
out.
lie. But I feel like Jello. I feel
yeah,
like,
good.
yeah, I
Good.
feel taller too.
Yeah. Well, see there, Lucy, you might want to take you out dancing tonight.
Out to dinner.
So, do you feel better now than when you walked in the door, Hector?
100%.
Great.
Yeah.
Well, thank you for sharing your experience with everyone on YouTube
Doc,
today.
thank you very much.
You're welcome very much.
Appreciate it.
This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas, with Hector from South Texas. We'll see y'all soon.